Now, in our first story, Parliament is promising to pass in the next 24 hours new legislation to back emergency measures announced by President Akufo-Addo Sunday night to contain the spread of coronavirus in Ghana. The president, in his televised address to the nation, announced a number of measures. Board will be discussing shortly. At a meeting with the presidency on Monday, the legislature agreed to fast-track the legislation. Speaker Michael Quay, however, ruled out suspending parliamentary sitting to protect MPs. Deputy Majority Chief Whip Matthew Nyindam, who sat through the meeting, tells journalists the new legislation will be introduced in Parliament on Tuesday. He says leadership of the House, from both majority and minority, pledged their support to the president.
In terms of the new legislation that will help deal with the coronavirus situation?
Well, I think that what we really agreed on, or what the president put across, was, God's willing, the Minister of Health, Attorney General, and then the Minister for National Security is supposed to get us the legislation by tomorrow. And we have to take it under the certificate of urgency to give backing to the present directives. So in the nutshell, I think that is what actually went on. But he got the backing of the House. The Speaker gave a strong indication, supported by the minority leader and obviously the majority leader, showing that tomorrow, if God's willing, the document gets to this House, we surely take it under the certificate of urgency to back the president.
And you say within 24 hours it will be passed?
Exactly, yes. We expect, like I said, under certificate of urgency, we don't have time to waste. And I'm sure it's not going to be any bulky document. It's going to be a very small legislation, and at the end of the day, we'll all support it and pass it under the certificate of urgency.
Was there a conversation around suspending sitting because the president has said gathering more than 25 shouldn't continue holding, and Parliament is more than 275?
Yes, Parliament obviously is more than 225, and like I said somewhere that, look, the present directive excluded Parliament because even the quorum to sit is more than 25. So if today we are going to deal with a legislation and the president says we should not congregate more than 25, then obviously the legislation we are bringing in Parliament will not stand. So obviously it doesn't include Parliament. But we are looking at measures that we also put in place to make sure that at least we don't unnecessarily congregate, okay, and putting the sanitizers at trying to, as much as possible, recognize and practice best practices that have been put out there for all of us to put into practice. We will definitely be observing it. We wouldn't be allowing people to flow in, out anyhow, and the public gallery may not also be open to the public apart from the media. So some of these things will be coming up very soon. But I think that's why we agree. But for Parliament to say a suspending sitting, I think that has not been part of the agenda.
And did it sound like the president was excited about the kind of support that he was getting from Parliament?
Oh, sure. President was excited because it's not just about the president, it's about all of us. It's Ghana as a nation, and we all have to support, okay? We all need to fight it, and definitely we will support the president at all costs.
Right, and joining us via Skype right now is parliamentary correspondent Joseph Opoku Gakpo. Hello, Joe. Now, we certainly in extraordinary times. Do you have any idea the measures announced by President Akufo-Addo that are making their way into this legislation?
So we gather that that would seek to give the state a form of emergency authority, not actually so that measures are the president indicated that was excited that even without putting out something in force, Ghana abiding that you don't push represented the ones approved. This document was kind of powers to rule outside dedicating resources to the problem, giving out the
Right, unfortunately, Joseph, we're having challenges with the audio connection to you. We'll have to try and re-establish connection with you. But moving on, as I indicated, President Akufo-Addo, in his address on Sunday night, announced a number of measures. It has resulted in empty classrooms, empty compounds, and idling students. And that is what you find in most senior and basic greater schools in the Greater Accra region after the directive. Now, some parents in the Greater Accra region are supporting the president's directive, but there are some who have a worry. They say the announcement should have come a lot earlier to them. so that they can be better prepared, or better prepare their children to stay at home during the partial lockdown. F4 Evans Chinri has more.
I'm out here trying to get parents to tell us exactly how they feel about the president's directive to suspend all educational activities until further notice. Well, some parents think that it is a good move to keep the children out of harm's way. Other parents think that the president is overreacting. Let us find out what other parents think as well. Pastor EMMANUEL OFORI is a graphic designer here in Accra. He woke up at 5 a.m. Monday morning to get his children ready for school and meet his business partner later at 10 a.m. Unfortunately, he'll miss this meeting because his children have to stay in the office with him. Pastor OFORI says he was not aware of the directive, so he sent his children to school. He says he's not worried about the situation because he feels children are best monitored at home.
So I got to the school compound before I heard that there's a short break for the students because of the issue coronavirus that has taken place. So when you got there, and decided to bring them to work because in the house nobody is there to take care of them. So that's why they are here with me.
Isn't this going to affect your business?
Not really, because even if it were to affect me, the situation now that has taken place, you can't do anything about it. You have to also help, because if you leave your children at the school, I don't know what will going to happen to them. So since the government has also trying to help us to also keep our children in the house for a while, so that they do not contract the sickness, it's normal.
Pastor OFORI's situation is not different from many parents who have had to either get people to take care of their children while they work or take their children with them to work. Some of them have been speaking to the news team. Your child is at home. Who is taking care of him or her?
Yeah, my wife is taking care of her. My wife is taking care of her for now. So we are praying that things will be okay and then they will start school soon. Yeah.
You're telling me that you didn't expect this to happen. Is it that you were not prepared for all of this?
Oh, sure. No one is prepared such thing. Yeah. Some years ago, we've been hearing this far, but for now, it has come.
The children shouldn't come to school. There is nothing we can do as parents. So only that we are expecting good and better condition.
How has your day been like? Has it changed your day in any way?
Actually, it's something like that, because the children are supposed to be in school as at now. But since they are not going, as parents, we have to be in the house taking care of them and make sure everything is intact. That's why. So somehow, someday, it will going to help. Problem like this, the government cannot solve it alone. It's only that the parents and then the children, all of us have to make sure everything is okay. So it's good, because the virus is very serious.
I think the announcement should have come earlier. Secondly, I think the government is behind time, because when he came and then made an announcement that he have allocated money for the various hospitals to work on the virus, at least should have been something that the money should have been disbursed for those hospitals to start working on it. But now that the release keep rising, I think now they say we'll have 6. We don't even know how true is that.
The Food and Drugs Authority in the Ashanti region has begun an exercise to track expired hand sanitizers on the market. Personnel of the authority mounted an operation on Friday following intelligence, though none of such products was traced. Regional Head Nora Nakite-Labi says the market surveillance will continue to protect the public.
No, I think because I indicated that they should ensure that the expiry date has not elapsed. Because if the expiry date has elapsed, then the manufacturer is not liable for anything. Our advice is for the people who are selling expired hand sanitizer, we're after you. We are after you. Now, ask the general public that if you have such information, if you purchase any such thing, especially in the Ashanti region, let FDA know. Let us know, give us the location. Like I said initially, somebody just gave us the information on Friday, and we quickly rushed to the place to ensure that the right thing is done. Unfortunately, by the time we got there, we didn't meet any of the products in stock. And so we did not find, we couldn't verify what the complaint was about. But we are grateful to receive such complaints, and we are happy to take action on them.
So you'd have to be on the lookout for that. Meanwhile, the authority has published a list of approved brands of sanitizers on the shelves. Mr. Labi revealed the authority is working hard to approve more of such to deal with the shortage.
Having said that, management of FDA is taking steps to quickly approve a number of hand sanitizers for the market so that the shortage would not arise. Of course, we have over 20 brands of hand sanitizers registered. And so since the country was not expecting this coronavirus to be an issue with us, that was why probably the manufacturers didn't bring more. I'm sure that now all manufacturers are trying to produce as much as needed to kind of satisfy the demand of Ghanaians. But FDA as an institution, we grant market authorization. So we are also ensuring that whichever hand sanitizers have been even submitted to us for approval, for registration, that probably may be in the system, we are trying to quickly work hard on it and make sure that we approve these ones so long as they are safe and they are of the nature and quality that we expect.
The University of Health and Allied Sciences is giving students a 48-hour ultimatum to vacate its Ho and Hwohoi campuses and any other affiliated facilities. This follows the President's directive for the closure of educational facilities, among other measures, to guard against the coronavirus spread in Ghana. Director of the Public Affairs Directorate of UHAS, Maria GWIRA, who announced this, indicated her outfit, in partnership with the Ho Teaching Hospital, has put in place measures to prevent and contain COVID-19 in the whole municipality. She added that subgroups tasked to work in 4 thematic areas with regards to the pandemic have been formed, comprising staff from the HTH and UHAS. She also mentioned that UHAS would embark on a public awareness drive on COVID-19 in the whole municipality, and that it's Say No to Coronavirus in Ho, Know How to Protect Yourself campaign.
On February 28th, the Vice Chancellor of the University, Professor John Osujapon, assembled an emergency meeting of officials from UHAS as well as Ho Teaching Hospital to strategize on an emergency preparedness and response plan toward countering the coronavirus, what we now know as pandemic, but at the time it was a medical threat. And so that group met that day, and out of that meeting, 4 subgroups were formed. All these comprised officials from UHAS and also professionals from Ho Teaching Hospital. The 4 subgroups that were formed included a clinical subgroup, a laboratory or diagnostic subgroup, education and training subgroup, and publicity and advocacy subgroup. So the objectives of the clinical subgroup are to sensitize and disseminate information to staff of UHAS and Ho Teaching Hospital. 2, to develop management protocols for suspected cases. 3, to identify a suitable isolation ward. 4, to mobilize resources, as in human resources as well as material needed, to set up a referral system for lab samples and patients. And these are the main objectives of the clinical subgroup.
Dr. Emily Yadom, who's on the clinical and laboratory subgroup, debunked rumors the Ho Teaching Hospital recorded a coronavirus case. She, however, indicated that a 4-bed isolation center has been set up with the hope of expansion to 20 beds. Now, Information Minister Kojo Nkrumah has been sharing details of their media and communication strategy to intensify public education on COVID-19. He was speaking at the stakeholders meeting with key media and some health organizations.
One of the first things we are doing is we are doing a public education campaign working with the Information Services Department so that every village, every hamlet, every chief's palace down there, every little market down there, they can get the word out. What is COVID-19? What do you have to do, etc. The Ghana Health Service has worked to produce materials that they need. And so from tomorrow, they are meeting their 16 regional directors who will be trained by the Ghana Health Service. And they will go out there, I think, from the weekend across the country over about a 3 or 4 week period, trying to get as much public education on the ground as they can get. That's one part of it. The other part of it is the infomercials, the things that we call commercials and LPMs that we are going to, or we have bought airtime on your radios and TV stations and in your newspapers, on your websites to advertise so that people have basic knowledge about this as they listen to your various programs. It started on Friday. It's been going on through the weekend. We are trying to ramp it up across the country so that those messages are played throughout your news bulletins and programs, etc. Again, all of those materials were designed by the risk communications team and the Ghana Health Service. We are only helping in amplifying and pushing it out there with as much muscle as we can. Now, the third leg is that we are bringing together what we call some public education ambassadors, some high-profile public persons who have large following, some of our musicians and footballers, etc., who can share some of the messages, or again, those same messages that have been produced, who can share it because they have huge personal audiences and brand equity. And we think at a time of national importance like this, we can tap into that following that they have to get the word out there. Some people will listen to Stonebwoy or Shatawale, they won't listen to me. And if Stonebwoy or Shatawale, are pushing out this message, they would also get to hear it as well. That's the third leg. Now, the final leg, which is why we are here, is the programming support through the media. Programming support through the media. We know that you are interested in getting as much information out there as possible, and sometimes you need resource persons to push out that programming support.
All right, you're watching Joy News Prime, and now we have some other release coming from the Kolebu Teaching Hospital. We would share with you right away. It has in the last hour, the Kolebu Teaching Hospital has in the last hour announced additional measures, including the suspension of all elective surgeries, and it is to help measures to forestall the spread of COVID-19. It says the Kolebu Teaching Hospital has taken the measures below following the directive by the President of the Republic for social distancing to forestall the potential spread of the COVID-19. The hospital has decided to suspend all elective surgical cases. Only emergency surgical cases will now be taken care of. The appointment system of the hospital shall be enforced, and patients are advised that they should only come to the OPD when it is really very necessary for them to report for care. The hospital has also instituted pre-triage monitoring of patients coming to the various outpatient departments. All rotations, internships of students have been suspended until further notice. Various departmental morning meetings and all other workshops, conferences are equally suspended. Visits by patients relatives to the hospital have been restricted to only 2 visitors while the patient is on admission. In the case of child health, only the parent, guardian, and are permitted to visit, and all visitors shall be screened. And then 7, staff and visitors to the hospital are all encouraged to observe the basic safety protocols, which include hand washing with soap and running water, cover your mouth and nose with a flexed elbow or tissue when sneezing or coughing, and avoid close contact with infected persons, among others. So these are measures being implemented with immediate effect to minimize overcrowding at the outpatient department at the Kolebu Teaching Hospital.